Thank you very much, Heather. Why are we here, right? It all starts, obviously, with trying to improve the lives of those we serve. We thought a lot about who should be part of an information governance summit. If you look at the list of folks that's on your table that have attended, you'll see a wider range of stakeholders. I'm really impressed that we have representation from all the health authorities and the Ministry of Health. We have folks that represent clinical and tech and privacy and legal and information management and IT and clinical practice areas. And you almost start to presume what a framework could be like by looking at the list of folks that are here. It's interesting in and of itself to consider that. But of course, it's not about us. It's actually why we're here, to improve the lives of those we serve and to be good stewards of our information for that sake. And so we thought it would be really important to start our day with the voice of a patient, and here to share with us her thoughts is Pamela Jessen. She's part of the Patient Voices Network, And I'd like you to join me in welcoming Pamela, and then we'll have a chance to move through the rest of the agenda. Thank you, Pamela.
Good morning. My name is Pamela Jessen, and I'd like to thank the organizers for asking me to bring a patient's perspective to this conference. I understand that your goal today is to develop an information governance framework that could maximize the benefits derived from our fast-growing information assets, makes the most out of our EHR and EMR solutions, and enables research and IT initiatives. Okay, so where do we, the patients of BC, fit into this? Let me share a scenario with you. Oh. Imagine you work in the ER at the Langley Hospital, and I show up complaining of extreme pain. And I'm not getting anywhere with the PowerPoint. Okay. I tell the nurses that I live in Victoria, and I'm here in town visiting my daughter. I have chronic pain from fibromyalgia and osteoarthritis, as well as other health issues, one of them being trigeminal neuralgia. Right now, I'm having a TN flare-up that has caused my overall pain to really increase beyond what I can typically manage. I also tell them that I use opioid medications, and I can't use morphine because of sensitivities. I need fentanyl. That's what they normally give me in the ER when I'm in Victoria. The ER personnel notice that I'm not really showing a lot of outward signs, other than my foot is tapping rather rapidly. And in fact, my heart rate and my pulse rate are fairly normal. I tell them that my pain level is a 10 out of 10, and I also have a diagnosed mental illness. So, what's your first reaction when you hear that? Be honest with yourselves. With a show of hands, how many of you started thinking drug seeker? And how many of you saw someone who was genuinely in pain and required help? Okay, so imagine if our system was built differently. I present to the ER, I tell the care team the same things, only this time you're able to go to your computer and you can pull up my information using my BC Health number, and instantly you're provided with my health history, which shows that I've been living with chronic pain for 25 years. I have one primary care physician, and I have one pharmacy that fills all of my opioid medications. There's clearly no sign of abuse of medication, and all of my health conditions and medications are listed so that any medical professional is able to see at a glance that they're dealing with a lot of complex issues. I'm going to list them here because I also want you to see how invisible diseases and illnesses can be really difficult to manage when a patient enters the emergency room. I live with fibromyalgia, chronic fatigue syndrome, myofascial pain, osteoarthritis in all my major joints at this point, my shoulders, elbows, knees, ankles, toes, fingers, lower spine, left hip. And this past February, I had a right total hip replacement done. I also have Forester's disease, also known as DISH, diffuse idiopathic skeletal hyperostosis, which causes bone spurs to form on my thoracic spine. I have Raynaud's disease, pelvic adhesions, inflamed tendons in my right hand. I have gastroparesis. I have trigeminal neuralgia. I have hyperthyroidism. I have type 2 diabetes. I'm on insulin. I have brachydactyly type E, and I have bipolar disorder. I laugh when I say it, but seriously, if it involves a muscle, a bone, a joint, or my brain, I probably have a problem with it. So, okay, back to our scenario. I would expect that after seeing all of this information come up on your computer screen, you're going to take my complaint of pain a lot more seriously, and hopefully, cross fingers, you're getting that fentanyl prepared for me because you realize that I need that, and you're also going to help me to find some new options for how I'm going to manage my pain. I absolutely hate going to the ER when I'm in overwhelming pain because I don't want to be treated like a drug seeker. No matter how legitimate my health issues are, there's always that fear that I'm going to have to deal with that kind of attitude with a nurse or a doctor because of having chronic pain. By having our technology linked together, though, you're going to improve that information system, which will go a long way to alleviate that type of anxiety for a lot of patients who are just like me. You'd be amazed at the number of chronic pain patients who would rather stay at home writhing in agony instead of going to a hospital because of the fear of how they'll be treated and judged. It really does become a crapshoot if no one's able to see their medical history. I've had poor treatment and I've had excellent treatment, and I've always presented myself consistently. Giving consistent and comprehensive access to professionals like you about medical information of patients like me is critical, no matter where we live or where we need it. When I first found out that our various health regions' information systems weren't linked together in a common database, I was shocked. I seriously didn't understand how that was possible with the modern health system that we supposedly have running. Now, I realize that there are challenges to putting in place an access and governance model with the kind of flexibility that reflects diverse needs and wishes, such as the legal and regulatory requirements of our privacy laws in BC. But I find it hard to believe that there isn't a solution for that. And I expect that with the excellence and the expertise in this room today, you believe that as well. If we truly want to provide patient-focused care, then we need to have the systems in place that provide that care for wherever patients are. To be successful, it's my personal opinion that all of you here today need to include patients in the planning, organizing, and design of an information governance framework from its beginning stages. By utilizing the skills of the Patient Voices Network, you can have patients be part of the working committees or ongoing discussion groups, making sure their voices are heard and their ideas are being implemented, keeping the focus on patient-centered care just as it should be. I would also strongly recommend that this system be one where patients either voluntarily opt in or opt out. This way, patients retain ownership of their information and have a right to decide who has access to it. I believe that we can provide that to patients one day. Health information that is safe and protected, yet able to be shared in a timely manner to ensure that patients get the best health care possible. Another reason that we need to be forming a framework for unity is for research. The patient voice is a necessary component in the world of research. The patients become more involved in their own care, and they have that desire to provide researchers with insights into what it's really like to live with a particular health condition or conditions. And they want to contribute to the design of studies and or the evaluation of potential treatments that may be available in the future, near or far, that lead to rapid growth of people looking for ways to become involved, to trying new treatments or medications in advance of these being approved by the appropriate agencies. By providing opportunities for patient access to a study looking for patient input is just one small example of how a unified framework connects us in the most basic of ways. I'm sure that you can all think of at least a few other ways this connectedness would benefit patients and in turn lead to healthier people in our health regions. I'm simply saying that despite the fact that there will be some obstacles, there will definitely be ways to work around them or through them, and we need to start thinking outside of the box to conceive, believe, and achieve. There are many organizations out there that are already doing great work, but if patients don't know about them, it won't make a difference in the long run. Rather than trying to find patients through a hit-and-miss system, the question becomes, how can you provide a more targeted approach in reaching the appropriate audience who can best be served now and in the future? So how do I think you can help patients like me? What I want is a life where I could go out on a date with my husband and actually stay long enough to enjoy dessert and coffee instead of having to rush home because of pain and exhaustion. A life where I could wake up in the morning and not cry as I try to get out of bed because of the pain. Where I could go back to enjoying singing with my barbershop quartet. I don't want to see my personal information available to just anyone, but I need care beyond my primary care physician. It's critical that other care providers need to know about me, and it's all connected in one location. If my information could be pulled up, seen, and relayed where necessary, that'd be an ultimate benefit in my books, definitely a dream come true. I want to thank you for the opportunity to share my thoughts as a person and as a patient who accesses the health care on a far too frequent basis. To wrap it up, I want to ask each of you to approach today not only from a professional point of view, but from a personal point of view. What if it was you in pain and frightened in that emergency room and alone in a strange city? What if it was you who was afraid of being judged each and every time you had to visit the emergency room? It's time to move forward as architects for the future of information. Architects for the future of information governance in BC, creating the framework necessary to unite the health regions into one region, the region of seamless health care everywhere for everyone. Now I challenge you to build it. Thanks.
There's really little more that needs to be said in some regards. You did a fantastic job here, and I want to thank you. To give this context, it's a powerful way to start a conference, and your sharing of your personal life takes a lot of courage, and you are bang on with the work that we need to do. On behalf of organizers, I'd like to give a small present thanking Pamela for her time here, and let's give her a round of applause again.